Hi everyone, welcome to Medicine Note YouTube channel. In this video, we are going to see about pressure sores. Pressure sores, it is also known as bed sores. It is otherwise known as bed sores. Now we will see about the pathophysiology of this pressure sores. The pressure sores occurs due to the compression of the tissue by an external force. Any external force which compresses the tissue, which causes pressure sores. The blood flows to the area. How it causes pressure sores? Because the blood flows to the area stops due to the external pressure, becomes more than 30 mmHg. When it exceeds more than 30 mmHg, the external pressure, the blood flow to that particular area gets stopped. And this causes ischemia of that area. Ischemia causes inflammation and tissue anoxia. Tissue anoxia leads to the cell death, necrosis as well as ulceration. Tissue anoxia means there is no oxygen supply to that area due to there is no blood supply. So there is no oxygen supply, so that the cell gets death and the necrosis starts as well as ulceration gets there. So this is how the pressure sores will be pathophysiology. Now we will see about the clinical features. It is a trophic ulcer with bone as a base. This pressure sores are the trophic ulcer it has a bone as a base, and it is non-mobile, deep, punched out ulcer. It is a non-mobile as well as deep, and it is a punched out ulcer. It is commonly seen in the old age and bedridden patient. It is mostly seen in old age people as well as in the bedridden people. The patient who are admitted in the hospital in the bed for many years, they will get this disease. The sites of this are over the ischial tuberosity area, sacrum areas, in heel, in relation to head, metacarpal as well as in buttock region over the shoulder. These are the areas where there is more pressure is applied by the external force, so that there is pressure sores are seen in these areas. These are the most commonly affected areas. Now we will see about the factors causing pressure sores. Normal stimulus relieve the pressure is absent in the anesthetized patient. Nutritional deficiency also causes worsen necrosis of the tissue. Now the staging of pressure sores. There are 4 stages of the pressure sores. The first stage is early superficial ulcer, late superficial ulcer, early deep ulcer, late deep ulcer. These are the 4 stages which is the staging of the pressure sores. In early superficial ulcer, there is non-blanching erythema is seen. In late superficial ulcer, there is partial thickness skin loss is seen. In early deep ulcer, there is full thickness skin loss extending into subcutaneous tissue but not fascia. Here there is full thickness loss extending into the subcutaneous tissue. It extends into the subcutaneous tissue but not into the fascia. It's known as early deep ulcer. The full thickness skin loss with the fascia underlying structure like muscle, tendon and bone, which includes the fascia also, then it is known as late deep ulcer. These are the staging of the pressure sores. Now the treatment of here are, it causes pressure sores should be treated, adequate nutrition supplement should be done, proper rest, antibiotic, regular dressing should be given. These are the treatment which should be done for the pressure sores. First, cause of the pressure sores should be treated. The cause of the pressure sores is the first to treat the pressure sores. After that, nutritional supplement should be given. As I have said, the nutrition deficiency causes the worsen necrosis. The necrosis will be more severe in that cases. So the nutrition supplement should be given. Proper rest like antibiotics and regular dressing should be given. Once the ulcer gets granulated, the flap cover and skin graft should be placed over it. Flaps and local rotation and other flaps should be given. Proper care should be given to the patient. Change in position of 2 hours by lifting the limbs. Every 2 hours we should lift the limbs and change the position of the bedridden patients upward for 10 seconds once in 10 minutes. Urinary and fecal care should be given to them. Hygiene should be maintained. Psychological counseling should be given. Regular skin observation, keeping the skin clean as well as dry. Oil massage should be given and the soft tissue using clean. soft tissue using the clean as well as oil massage is given, and you should keep the skin dry, not too wet, because it causes necrosis. That's all. Thank you. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment it. If you want more videos, please do subscribe. I will put this note on the Instagram channel. Please do follow in the Instagram also. Thank you.